Ahora voy a sí. Okay. ¿Estamos?
Sí.
Hello. How many of you here today visit your gynecologist on an annual basis? How many of you who do visit your gynecologist on an annual basis ask to be tested for ovarian cancer? Nobody. Now, for those of you who do not think that it is necessary to visit your gynecologist on an annual basis, I would like to share a personal story. My mother actually once thought the same and went about 5 years without seeing a gynecologist. One day, in my family, we started noticing that her abdomen was growing. But we thought she was just getting fat. After about 3 years of her abdomen growing and nothing else, my mother started getting concerned and decided to visit her gynecologist. It turned out that she had an extremely malignant case of ovarian cancer, which actually almost killed her. I was 12 years old at the time, and at the age of 16, I personally scheduled my first gynecological visit and have seen a gynecologist every single year ever since then. Today I have come here in the hopes of persuading all of you of the importance of not only visiting a gynecologist every single year, but also asking to be tested specifically for ovarian cancer. Now, let's look at some of the symptoms, risk factors, and statistics surrounding this type of cancer. 1, symptoms. This list is not exclusive, but these are the major symptoms that scientists today know of. If you have pain or pressure in the abdomen, the back, the pelvis, or the legs, this is considered a concern. Nausea, gas, constipation, diarrhea, indigestion on a frequent basis is also a concern. If you have a swollen or bloated abdomen, if you feel the need to urinate a lot, if you feel tired all the time, if you're gaining or losing weight radically, if you have no appetite whatsoever, if you have shortness of breath, and if you have unusual vaginal bleeding or menstrual cycles. Some of the risk factors include any woman who has a family history of ovarian, uterus, breast, rectum, or colon cancer is considered high risk. Any woman over the age of 55, and any woman who has never been pregnant. Lastly, any woman who has been taking menopausal hormone therapy for over 10 years is also considered high risk. Now, I'm going to only share 2 statistics because I feel that they're the most important. Over half of the deaths caused by ovarian cancer in women occur between the ages of 55 and 74. And approximately 1/4 of these deaths occur between the ages of 35 and 54. Now, I would like to make one thing very clear. None of these symptoms or risk factors are considered 100% certain. As a matter of fact, most women that have been diagnosed with ovarian cancer never showed any symptoms and were not considered high risk. One of the most worrisome problems surrounding this disease is that it is very hard to detect in the early stages. As a matter of fact, most women that have been diagnosed, when they are diagnosed, they are already in the late stages of cancer, it is malignant, and they have to start using radical measures such as chemotherapy to cure, if at all possible. Now, maybe there are some of you in the audience who are still thinking to yourselves, I see my gynecologist every year, I'm okay. Actually, most of you probably do not know that the standard OB/GYN tests do not check for ovarian cancer and are not capable of testing for ovarian cancer. So the best possible solution is 1, to see your gynecologist every year, and 2, speak to them about the possibility of being tested for ovarian cancer regardless of your age, regardless of your family history, and regardless of your symptoms or lack thereof. Now, to conclude today, I would like to finish with one more statistic which I feel stresses my point very well. Ovarian cancer is the 5th leading cause of cancer death in women, and it is the leading cause of death due to gynecological malignancy. So again, I urge you to visit your gynecologist on an annual basis, because this deadly disease strikes with little or absolutely no warning. I've had to live through this experience personally. I've had to watch my mother almost die due to neglect of something so simple as an annual checkup. And I cannot express to you the pain that it caused not only my family, but my mother, Princess. So I hope that I've been able to persuade all of you today of the importance of taking responsibility for our bodies in order to prevent this deadly disease from affecting our families and our lives. Thank you.